Here at CIRSE, I have the opportunity right now, this afternoon, to present the 24 months results for efficacy and safety. And you will be surprised that you do not have the effect of increased all-cause mortality for the luminor balloon after 24 months.
So there is definitely no class effect.
There is no class effect, and this is also true for the all-cause of mortality.
So Ulf, with the mortality signal and the safety signal that we have today, you know that especially for all drug-eluting clinical trials, it is extremely important to have longer-term follow-up. So can you give us some data out of the EFFPAC trial to clarify this discussion?
Exactly. Today we are looking at the 24 months results, and we can say that we only had one all-cause of death in the paclitaxel group as compared to 2 deaths in the POBA group. This means there is no difference between both groups, which is a very good sign. Most of the other trials showed a tendency towards all-cause of mortality. I believe this is also due to its great efficacy, because it's important that the paclitaxel we apply is really applied at the target lesion and that there is no loss of any paclitaxel during vessel transfer. We are now looking at the 3rd generation with luminor, with a very innovative nanotechnology, which allows that the drug release is really only at the target lesion alone, or mainly at the target lesion, and this I think also affects the all-cause mortality, if this is really true. Some are arguing that in EFFPAC trial we only look at shorter lesions of TASC A and B. You performed the TINTIN trial looking at longer lesions. So how was your results in this trial?
I'm completely impressed by these 2-year results of the EFFPAC trial, let's be clear. But indeed, mean lesion length 5.9 centimeter in the DCB group with a bailout stent ratio of 15%. So I mean, this was also thinking me on my daily cases and my daily practice. I don't see a lot of 5.9 centimeter lesions. The majority is TASC C and D lesions. And we know out of other trials that in these kind of lesions, longer than 15 centimeter, we have a higher bailout stent ratio. So with this knowledge, I think it was worthwhile to test the combination of 2 products that already proven their efficacy. On one hand, the luminor, very clear with the EFFPAC trial. On the other hand, the iVolution stent in the eVolution trial. And so I think that the combination is perfectly investigated in the TINTIN trial. It's a trial with 100 patients where we have now a 6 months follow-up in the full cohort, where we treated a mean lesion length of 24 centimeters. We have almost 30% of CLI lesions and a lot of severely calcified occlusions. So even with these difficult disease, we reached a primary patency of 96% after 6 months and freedom from TLR of 98%. So I think these are amazing results. On the short term, we need to wait for 12 and 24 months follow-up, but in these type of lesions, this is a very clear and good signal.